Hello everyone, hope you're doing good and today we are going to discuss about scope of mental health nursing. What is the scope? Whether this career is demanding or this career is not demanding, or if it is demanding, in which aspect it is demanding, that we are going to discuss in this video. Before going to video, we will discuss a quote. Today's quote is, the purpose of our life is to be happy, according to Dalai Lama. So he's telling that most of them are fixing on problems and more targets rather than fixing on our happiness and our passion. If you fix on and if you're thinking about your passion, your goals, your happiness, definitely your life will be more functional, your life will get more glow. And so the purpose of our life is to be happy. If you are trying to be happy, you can perform well, you can perform like a mentally healthy person, completely mentally healthy person. So try to be happy. And we are going to the video. Today we are going to discuss about scope of mental health nursing. Before, again, as usual, I'm telling what's the definition or what's the meaning of mental health. Mental health is a state of maintaining a balance between an individual and his or her surrounding. Or simply, I can tell you, it is an ability to maintain a harmony between you and your surrounding. It is an ability to maintain a balance between you and your surrounding. If you can able to adjust with the surrounding, if you can understand the people, if you can show love, if you can take love, if you can care others, if you can respect others, it indicate that you are mentally healthy. So we can say it is an ability to maintain a balance between you and your surrounding. That's known as, or that's called as, mental health. What is the scope of psychiatric nursing? This career is a good career. Yes, and the scope of psychiatric nursing is depend upon some factors such as activities and accountabilities of mental health, who, what, when, where, and how mental health nursing is practicing, advanced nursing skills, diverse activities, clinical practices, education and research. Of course, activities and accountabilities are good in the field of mental health, means it indicate what scope is there. Lot of job opportunities are there, and where and when and how this is working and what kind of nursing skill we are using, that also define the scope of psychiatric nursing. Then diverse activities, practices, education and research, all these things will decide the scope of psychiatric nursing. Next is, what are all some trends which increase the scope? Increasing the number of mentally ill people, of course, will increase the scope of psychiatric nursing. Then pandemic like corona like situations will create an imbalance in the mental status of the person, and that may increase the scope of psychiatric nursing. Next is provision of good quality service. If you give more good quality service, means it indicates that everyone will come to take the service. So that also increase the scope of psychiatric nursing. And continuing care will increase the scope of psychiatric nursing, and of course alternative way of giving care. In the same way we are giving care for everyone, means scope will not increase. But if you're giving care in different way, in different aspect, in different modalities, in different method, definitely the people will get attraction, and automatically that will increase the scope of psychiatric nursing. Next, issues which increase the scope of psychiatric nursing: industrialization, urbanization, globalization, poverty, vulnerable population, elderly caregivers, government support and different mental health act. These are all some issues which increase the scope of psychiatric nursing. What is urbanization? Urbanization means increase the number of cities and urban population. So this kind of development, this kind of globalization, urbanization, industrialization will increase the number of cities, number of people, crowd will increase. Automatically the family pattern will get changed, and the people's what economic status, social status, and mainly the psychological status will get changed, and this may create lot of mental health problems. And if the mental health problems increasing, means automatically the scope of psychiatric nursing will increase. And another thing is vulnerable population. There are a lot of vulnerable populations are here. You may know, like what uh, victims of different kinds of abuses, sexual abuse, child abuse, then dowry problems, then childhood traumas, then interallies, and old people, elderly peoples, then homeless people, wandering people. These all people are facing one or another kind of psychiatric problem or emotional imbalancing situation, and these kind of situations are actually increasing the scope of, that's the saddest part of our life, but still it is increasing the scope of psychiatric nursing. Next, there are different departments in psychiatry and mental health nursing, and these department increases the scope of psychiatric nursing. There are different departments are there. This department is increasing the scope of psychiatric nursing. Among that, first one is forensic psychiatric nursing. This department is related to individuals who have entered to different legal systems. Forensic psychiatry is having lot of job opportunities. Forensic psychiatric nursing provide treatment and rehabilitation service to criminal people or who were involved in any crime. So forensic psychiatry is a department, and this department is having lot of job opportunities, and it indicates psychiatric nursing is having scope in forensic psychiatric nursing department. Next is nurse generalist. Means a licensed nurse who can provide mental health care. They can work in different areas like community centers. So there we have scope, daycare centers, mental health hospitals, rehabilitation facilities, and de-addiction centers, shelter homes, etc. So nurse generalist is another scope of psychiatric nursing. Next is psychiatric nurse specialist. Means who have a degree in or master degree in psychiatric nursing. They are responsible for providing overall care for the mentally ill person along with physician, and they can work as psychotherapist, different therapy specialists. So this also indicate the importance or scope of psychiatric nursing. Next is community mental health nurse. Community mental health nurse is working in the community level and providing diagnosis, treatment, care and rehabilitation service for mentally ill people who is residing in each community. So community mental health nursing is another scope or another area of work in mental health nursing or psychiatric nursing. Next is home care psychiatric nurse. They are providing direct care to the patient in their home, and they will provide variety of care like crisis management, behavioral therapy, recreational therapy, psychoeducation, providing medication, substance abuse treatment, etc. So that is the another scope, home care psychiatric nurse. Next is licensed nurse. This nurse who work in non-psychiatric setting and providing necessary care, support and counseling to people who have affected with anxiety, stress, depression and other psychological related problems. That is the another scope of psychiatric nursing. Next is case manager. Nurse manager act as a bridge between the doctor and other members of healthcare team. They will work in the community as well as in the hospital. They are mainly helping financial management, mentally ill persons transportation, admission and discharge procedure, and their outside shopping works, etc. That is the another scope of psychiatric nursing. Next is the telehealth psychiatric nursing. They are engaging in telemarketing and technology usage such as internet, telephone, telemonitoring, digital marketing to provide nursing care to need people as well as to educate the people. We have telepsychiatric nursing department in all multi-speciality hospitals like Apollo Hospital, holistic and rehabilitative nurse. That's another scope of psychiatric nursing. They are integrating mental health service with alternative therapy and public health services and system of medicines like yoga, meditations, etc. So holistic and rehabilitative nursing is another scope of psychiatric nursing. Next one is research nurse. They are involving in variety of researches. They do researches in different aspects of psychiatry, different psychological problems, scientific studies, peer review journals preparation, presentation, article writing, survey programs, and they are actually doctoral and postdoctoral qualified people. That is the another scope of psychiatric nursing. And other department include nurse educator, clinical instructor, healthcare administrator, neuropsychiatric department nurse, child psychiatric nurse, rehabilitation nurse, social worker nurse, counselor nurse, nurse manager, nurse pharmacologist, healthcare support worker, accountant and registry workers. So these are all the another departments we can see in psychiatric nursing. These all indicate the scope of psychiatric nursing. So psychiatric nursing is a good career and it pays well, and it is demanding, and in some aspect I will tell you it is more demanding, but there are some risk factors also, like we need to deal with mentally handicapped people, that means mentally ill people, and they will show different mental stage in different time. So To work in this field, we need to show more empathy, kindness, confidence, and patience. Hope you understand. Thank you.